That $1 billion in net income. That is money not spent on patient care.
That's right.
That is money not done to improve staffing and improve quality. That is money spent for the needs of the institution, not the community. That is what healthcare has become in this country. And it started in 1980, as Elizabeth Rosenthal, a healthcare journalist, has written. And the transformation, we used to have a system where it wasn't perfect by any means, but it was community hospitals, it was nonprofit insurance companies, and it was doctors who were accessible, that we could either figure out how to pay them, but they were members of our community and we were able to get the care we need. But that system has broken down in a fundamental way, obviously. And what Rosenthal says is something I think we can relate to, not just in healthcare, but throughout society, where money has become the metric of good medicine. If it makes money, it's good. What is more telling, right, culturally, than that notion? And so we're basically presented with a healthcare industry that puts revenue and profit ahead of anything else, because that tells you, oh, if you're making a lot of money, if you have net income, you're doing good, you're successful. But in fact, Senator Sanders offers another question. What is a healthcare system for? Can we start with that? A healthcare system is to promote health and well-being. How can you do that when you have thousands of insurance companies who have folks on the phone looking over every order that the doctor places, questions every MRI that they order, wonders if there's a cheaper prescription drug that they could use instead? How can that be a system of caregiving? How can that be a system of meeting patient needs? It can't. When you have thousands of insurance companies, what are you doing? You're creating huge billing departments in hospitals to manage those companies, to understand all the rules. You know how much that costs a year? $450 billion can be saved when we do what Rose says and eliminate the private insurance companies. $450 billion. That's right. My applause line is the number. All right. So, but here's the other number. Here's the other number. Because remember, what's a healthcare system for? Health and well-being. And what is our movement for? Our movement is a movement to save lives. 68,000 lives saved by going to universal health care, according to Yale researchers published in The Lancet. 68,000 lives saved.
Per year.
Per year. Thank you. Per year. 450 billion per year. 68,000 lives per year. This is what matters. So when the senator talks about Medicare for all, he's talking about creating a system that cares for us and cares for all of us, because at the heart of it, it's solidarity. It's social solidarity. That's the value that counterposes to the selfishness, as Rose said, or counterposes to the notion that we've been living in. We have been living in a country since 1980 where healthcare has become an industry, and Ronald Reagan established the political paradigm where government's the problem and taxes are the issue. That sound a little familiar? Right? Talking about Medicare for all. Oh, government healthcare that's going to raise your taxes. This is the politics that this campaign is blowing up. That politics that says government is the problem and can't do anything for us. No, we are the government, and we are taking the government in the hands of the people. That's what this campaign is doing. That's what not me, us means, is creating a government that says, no, Ronald Reagan, no, you Republicans, we're going to organize ourselves collectively, and we're going to address the social determinants of health, the structural racism that prevents people from getting the care they need, whether they're redlined into neighborhoods or prevented from getting jobs, whether they are dying as a result of racism when black women give birth, or whether Latinos who are the most, and Native Americans are the most uninsured in this country. All those aspects are part of an industry that says if you are a marginal person, you're not profitable, so you don't count. That is literally what happens in healthcare. And if we challenge that industry model and create a caregiving system founded in the values of caring, compassion, and community, we're not just changing healthcare. We're creating an alternative ethos for society that says we are of a kind and we bring kindness to our work and to each other, because human kindness is the basis of caregiving. And it's the basis of healthcare. And we know in other countries, we know. That's why the senator asked this question, what is the healthcare system for? Because when they created Medicare in Canada, they created a sense of solidarity. You go to someone in the UK, Tory or Labour, and they will say, no, the National Health Service is what makes us a special place. That's what takes care of us. That's what gives us our identity and a sense of social cohesion, in fact. It's not perfect. By no means is it perfect. But imagine a country where we're not just at each other's throats as individuals trying to get money just to survive, because that you can't survive without money in this society. There is no social safety net. But imagine a society where we really felt, you know what? I'm going to be able to get the health care I need. I don't have to pay a copay. I don't have to pay a deductible. I don't have to pay a premium. I know that I'm going to go to the doctor and get the health care I need. Who feels that today? Who feels that today? That's right. We can have that. We're told, oh, healthcare is so complicated, and God, the industry is so powerful, and you know, we just can't do these. And in fact, I think I've heard a senator from the state say that. Didn't I? I think I heard that. Now, my understanding is that, in fact, it's the position of the Minnesota Democratic Party that we need Medicare for all.
That's correct.
Right? The Minnesota Democratic. So I'm trying to figure out how the senior Democratic senator from Minnesota doesn't agree with her party, right? The DFL.
Maybe she's not enough.
I didn't say that. It's just a question, right? So here's our opportunity. Here's our opportunity. Imagine Tuesday night that in fact the Medicare for All candidate wins the Minnesota primary. Can we imagine that? And what does that say about Medicare for All? What does that say? In Nevada, 60% of voters supported Medicare for All. There were casino workers who said to the union, man, we love you, we love our health plan, but you're wrong. We're voting for Senator Sanders.
Yeah, that's awesome.
And that's a great union, but they were wrong on that question. New Hampshire is 57% for Medicare for All. Iowa, 57%. You should have seen the ads. Anyone in Iowa see all those ads against Medicare for All?
Yeah.
Yeah. Why, in the face of all that spending and all that opposition, are we winning on this issue?
People are dying.
Because people are dying, and because we know in our gut it's wrong. They can spend millions, and we still know in our gut it's wrong.
Right? Yeah.
76% of us say we need fundamental change or a completely rebuilt healthcare system. 92% of Americans say we need change in healthcare. 44% of voters say it's the top issue. 65% of Americans say an unexpected medical bill is their biggest worry of everything. An unexpected medical bill. 140 million Americans experience financial hardship every year because of healthcare. There's only 150 million of us on private insurance, on employer insurance. These are what matter. This is why we're going to win. Because it's our experience, and our experience is in the most intimate areas of our life, public policy has failed us. Incremental changes have failed us. So this is our transformative moment. This is our chance to say, no, Ronald Reagan, you're wrong. No, establishment Democrats, we're not going to just do another piecemeal reform that doesn't solve the problem. Because I am tired of hearing from Midwestern pragmatists that are not going to solve the problem. We're done with that. We are done with the murderous industry. We are done being told we don't deserve it. We're done with being told it will never ever happen. On Tuesday, in this state, we're going to send a message that says, no, we reject the politics of can't in favor of the politics that will transform this country and create the solidarity that will establish justice and caregiving. Thank you very much.